welcome once again to our lesson. I am Obane Kirsten. In this lesson, we'll be looking at the subject, Physical and Health Education, and we'll be taking the topic, Pathogens, Diseases, and their Preventions, Part 3. So we are continuing from what we've been learning on communicable diseases. So by the end of this lesson, you should be able to still define communicable diseases and explain the nature of some communicable diseases like malaria and pneumonia. You should be able to state the causative agents, mode of transmission, and disease factors of malaria and pneumonia. In part 2 of this lesson, we looked at measles and mumps as other kinds of communicable diseases, and we also looked at their causative agents, complications, preventions, and treatments. So for this lesson, we are looking at malaria and pneumonia. So to help us recollect what we learned in the previous lessons, okay, we said that some diseases are communicable, meaning that they are transmittable. They can be transferred from an infected host to a healthy host, all right? And some other diseases are non-communicable, meaning that they cannot be transmitted from an infected or sick person to another person. Communicable diseases, as in these transmittable diseases, are carried by infectious microorganisms. And we say that these infectious microorganisms are called pathogens. Examples are viruses, bacteria, fungi, and so on and so forth. So they are transmitted through infected people or through surfaces, food, air, animals, and this transmission can be directly or indirectly. You may need to refer back to the part 1 of this lesson where we talked extensively on the 2 types of contact. We have direct contact transmission and indirect contact transmission. So you get to know the kind of transmission that we refer to as direct contact and the types that we refer to as indirect contact. Examples of communicable diseases are pneumonia, meningitis, malaria, mumps, influenza, chickenpox, ringworm, measles, etc. Any kind of disease that can be transmitted from an infected person to another host. Now we'll be looking at 2 of these communicable diseases, malaria and pneumonia. So we're starting with malaria. So that malaria is an infectious disease carried by an infected female Anopheles mosquito. Okay, so the host of this infection is what? The female Anopheles mosquito, an infected female Anopheles mosquito. Malaria affects humans and other animals. So you may be wondering, oh, can I get malaria from someone who is sick from malaria? You may not be able to get malaria directly from someone, as per you may not be able to get it through direct contact transmission. But if an infected mosquito, a mosquito that has been infected with the malaria parasite, okay, bites a healthy person, then that person is likely to contact this disease. Infected mosquitoes carry what we call the Plasmodium parasite. So this image shows us a plasmodium from the saliva of a female mosquito moving across a mosquito cell. So bites from an infected mosquito will introduce the parasite from the saliva of that infected mosquito into a person's blood stream. So we can see an image here, okay, of a mosquito biting someone on the arm. The Plasmodium parasite, okay, is carried in the saliva of the mosquito. When the mosquito bites a person, this parasite goes into the person's bloodstream. From the bloodstream, they travel down to the liver. Now, this parasite infects liver cells and multiply asexually. Now, these infected liver cells will eventually burst and release Plasmodium cells called merocytes that infect the red blood cells. So these red blood cells are infected. These merocytes will now reproduce asexually again inside the red blood cells. Infected red blood cells will look this way, and they would also multiply and burst, releasing merocytes that infect other red blood cells. Some cells release gametes that can now infect other mosquitoes. Now, this person that this parasite has gone through his body and has infected the liver and the red blood cells is now an infected host. Is now someone carrying the malaria parasite. Okay? So when an uninfected mosquito bites this person, that mosquito is going to get infected. And when this infected mosquito goes on to bite another healthy person that is not, carrying the parasite, it's going to transmit the parasite to that healthy person. So this is how malaria gets transmitted from one person to another through the bite of mosquito. So we can see in this image, an infected person, of course, is already showing symptoms of malaria. The person is already sick. When this person is bitten by this mosquito becomes infected. And you can see a healthy person just strolling by. This infected mosquito goes on to bite this healthy person, and the person also becomes infected with malaria. Symptoms of malaria usually begin in 10 to 15 days after a person has been bitten by an infected mosquito. Now, we'll be looking at signs and symptoms of malaria. Although these symptoms are not peculiar to malaria, but they are some of the signs that show that one has this infection. Okay, we have high fever, shaking chills, tiredness. The person will feel headache. The person may also feel like throwing up, vomiting. The person may have muscle pains, anemia, diarrhea, and convulsion. All these are signs and symptoms of malaria. You may not have all these signs. You may just have some of them, and another person may exhibit other signs of malaria disease. But in severe cases, malaria can lead to yellow skin, bloody stool, seizure, coma, and even death. So this is why it's important that once we get these signs, we get tested for the disease, and once we test positive, we must treat ourselves immediately. Now, this disease can even reoccur if not properly treated, or if one does not put measures in place to prevent mosquito bites. So this means that even if you have treated malaria, but you do not put measures in place to prevent mosquitoes from biting you, okay, then you may still get bitten by an infected mosquito, and you will have malaria again and again and again. Malaria is more common in underdeveloped parts of the world, such as in the sub-Saharan Africa, Asia, and Latin America. There are medications available for the prevention of malaria. For travelers to areas where the disease is common, especially people traveling from the much developed parts of the world where malaria has been eradicated, to maybe places like Africa and Asia, there are preventive measures that are given to these travelers so that they do not catch the disease. But so far, no effective vaccine exists yet against malaria disease. However, efforts are still being made to develop a vaccine. Okay, mode of transfer, we've established that infection with the disease is typically through the bite of a female infected Anopheles mosquito. The malaria disease is transmitted by blood. Therefore, it can also spread through other means such as an organ transplant, a blood transfusion, use of shared needles or syringe, and also from mother to baby at birth. And this kind of malaria is known as congenital malaria. Disease factors. We've established that disease factors are those things or situations that increases our chance contacting a disease. So disease factors associated with malaria are: 1, living in places where the parasite is prevalent. We say that the parasite is prevalent. The malaria, especially Anopheles mosquito, that is prevalent in places such as Asia, Africa, and the sub-Saharan regions. So people living in these areas are more prone to, contacting the disease. Also, living in environments where there is stagnant water. Stagnant water provides a breeding place or site for mosquitoes, okay? So it's important that we always have our environment, our surroundings clean, and also prevent stagnant waters from forming, because mosquitoes can easily breed there. Then another disease factor is sharing sharp objects. We have known from this lesson that malaria can be transmitted through blood, and one of the ways that it can be transmitted is through sharing of sharp objects. So when we are always sharing sharp objects, it increases our chance of contacting the disease. Then malaria complications. Life-threatening complications can arise, especially if the disease is not treated on time, or if treatment is delayed. Some of these complications are cerebral malaria, which causes swelling of the blood vessels of the brain. Okay. Another complication is pulmonary edema. It's simply the accumulation of fluid in the lungs that causes breathing problems. Another complication is organ failures, such as failure of the kidneys, liver, or spleen. Then we have anemia. This occurs due to the destruction of the red blood cells. Then we have low blood sugar. These are complications that come from not treating malaria. Treatment of malaria. The treatment of malaria is provided in a hospital after diagnosis of the disease. So even if you have the symptoms of malaria, you don't need to treat malaria immediately until you've run a test to really make sure that you have malaria. Then after the test comes out positive, the doctor will definitely prescribe certain drugs or certain medications for the treatment of the disease. Now, sometimes the medication prescribed may not be able to tackle the infection effectively due to what? Resistance that these parasites may have developed to that drug. Some drugs are not so powerful. So even when they are being given for the treatment of malaria, the parasites would have actually developed some resistance to such drugs, and it will not work. So at times like this, what happens is that a doctor may need to use more than one medication or change medication in order to treat the disease effectively. Some people take more than one dose of the malaria medication. Some other times, the medications are changed, maybe from a less powerful to a more powerful medication, in order to knock out or destroy the parasite from the body. So that's that on malaria. We're looking at another communicable disease, pneumonia. Pneumonia is an inflammatory condition of the lungs that primarily affects the small air sacs known as alveoli. Infection with this disease causes the alveoli to be filled with fluid or pus, making it difficult for an infected person to breathe. So pneumonia is caused by infection with viruses, bacteria, or fungi. So we have a bacterial pneumonia represented on the board here. We also have viral pneumonia, we have fungal pneumonia. So treatment of pneumonia usually depends on which of the pathogens is causing that particular pneumonia. Although pneumonia caused by bacteria is the most common form of pneumonia. Usually, our body has, immune system that tries to fight against diseases when they try to invade our body. So the body tries to fight against these microorganisms as they attempt to infect the lungs. But if a person's immune system is already weak, the germs can overpower it. Signs of pneumonia. We have fever. So fever is one of the signs that someone has pneumonia. Dry cough, chest pain, especially when one is breathing or coughing. Troubled breathing, finding it difficult to breathe properly. Confusion or changes in mental awareness, especially in adults who are 65 years and above. Another symptom is fatigue, lower than normal body temperature. This is common with older people with weak immune systems. We have nausea, vomiting, and diarrhea. So these are all signs and symptoms of pneumonia, but when you have these signs and symptoms, you need to go for a proper test to really determine if you have pneumonia. Now, there are specific people that are at a higher risk of developing pneumonia. These include very young children, children that are below 2 years of age. So another set of people that are at a higher risk of developing pneumonia are people with weak immune systems. We've said it earlier that when these diseases try to invade the body, the immune system fights against them. But if the immune system is weak, the diseases will definitely overpower them. So people with weak immune system are prone to developing pneumonia. Very old people, adults who are 65 years and above. Then another set of people at risk are people taking medications or treatments that tend to suppress their immune system. An example of such medication is chemotherapy. People with negative habits such as smoking, misuse of illicit drugs, and then people with certain chronic health conditions such as asthma, heart failure, and diabetes. Pneumonia is more prominent in developing countries around the world. A preventive measure against pneumonia is vaccination, so people can get vaccinated and not get pneumonia. There are vaccines available for the prevention of certain types of pneumonia. Remember, we said that pneumonia can be caused by bacteria, fungi, or virus. Other preventive measures against pneumonia would be washing of hands and avoiding smoking. Mode of transfer of pneumonia. Pneumonia is contagious. It can be transmitted through the following. Viral and bacterial pneumonia can be transmitted by inhaling airborne droplets from an infected person who sneezes or coughs. We see a kind of indirect contact transmission, okay, where an infected person sneezes or coughs, and then the air carries the droplets that comes out from the person's body, and then when those droplets touch someone else or a healthy person in that same environment, the person becomes infected with the disease. Okay, so this is how viral and bacterial pneumonia are transmitted. It can also be spread through contact from person to person. Fungal pneumonia, on the other hand, can be transmitted in the environment but cannot spread through contact from person to person. Disease factors of pneumonia. Now, these factors can increase a person's chances of developing or contracting the disease. Individuals with health conditions such as asthma, heart failure, cystic fibrosis, diabetes, a history of smoking. If you're an individual with these health conditions, your chances of contracting pneumonia may be quite high. Also, living in close proximity to an infected person, okay? So people who live close to or who live in the same environment with people that already have pneumonia have very high chances of developing the disease. Complications of pneumonia. These complications include bacteremia, which is a condition in which the bacteria spreads to the bloodstream. Another complication is lung abscesses. This is a condition where the lung cavities contain pus. Impaired breathing. This is trouble getting enough oxygen when breathing. Then another complication is acute respiratory distress syndrome, which is a severe form of respiratory failure. And then last here we have is death. Of course, some people die from this disease, especially if treatment is delayed or even ignored. How do we treat pneumonia? The treatments used depend on the microorganism responsible for the disease. So it will depend on if the pneumonia is viral, if it's bacterial, or if it is fungal. Prescribed treatment for pneumonia includes treatments with antibiotics, antiviral, and antifungal medications. This, of course, depends on the type of pneumonia. If it's pneumonia caused by bacteria, we can deal with them with antibiotics. Pneumonia caused by virus, we can deal with them with antiviral medications. While pneumonia caused by fungi, we can deal with them with antifungal medications. Use of over-the-counter pain relievers like ibuprofen and acetaminophen would help relieve pain and fever. Use of cough medicines to calm cough. Remember, we said that one of the symptoms of this disease is what? Dry cough. So we can use cough medicines to calm cough, which is of course a symptom that comes with the disease. Then another thing we can do is hospitalization. The person may need to be hospitalized if the symptoms are very severe or if there are other health problems. In the hospital, treatment may include intravenous antibiotics, respiratory therapy, and oxygen therapy. Home treatment for pneumonia. People can also be treated at home by the use of oral antibiotics, especially if it's known that is bacterial pneumonia. Oral antibiotics can work. Then the patient will need to get a lot of rest, and the person may also need to drink plenty of fluids in order to be able to recover fully from the disease. So with this, we have come to the end of this lesson. We said that communicable diseases are carried by infectious microorganisms like bacteria and virus. They are transmitted through infected people, surfaces, food, air, animals, objects, directly or indirectly. We also say that malaria is an infectious disease carried by an infected female Anopheles mosquito. It affects humans and other animals. Then we looked at pneumonia. We said that pneumonia is an inflammatory condition of the lungs that primarily affects the small air sacs known as alveoli. Infection with this disease causes the alveoli to be filled with fluid or pus, making it difficult for infected persons to breathe. So we'll quickly take some questions. Number one question: malaria is an infectious disease carried by dash. A, infected female Anopheles mosquito. B, healthy female Anopheles mosquito. C, infected male Anopheles mosquito. So the correct answer is A. From our lesson, we learned that there is an infected female Anopheles mosquito that transmits the Plasmodium parasite. Another question: which of these are symptoms associated with pneumonia infection? A, high fever and shaking chills. B, tiredness and headache. C, dry cough and chest pain. Well, from our lesson, the answer is C, dry cough and chest pain. We listed these two as signs and symptoms of pneumonia disease. So with this, we have come to the end of this lesson. We'll be seeing in another lesson where we'll be talking about non-communicable diseases. Thank you for staying with me.